Well, I think it's about time to get started, but before we do, we're going to take a quick break, and when we come back, we're going to hear from Mike Sicilia, who is the EVP of Oracle Global Industries.
I'm here with Mike Sicilia, the Executive Vice President of Oracle Global Industries. Thanks for joining us.
Always great to be back on Oracle TV. Thank you for having me.
All right, we're going to talk healthcare today. The theme of the conference is the future of healthcare. How would you characterize what's broken about today?
Well, if you look at the clinical systems today that are widely in use, there's a fatal flaw in that they were mostly designed by billers. So they were mostly designed for providers to be able to bill for the service. And there's two things that have happened recently that are really upsetting that paradigm. The first is there's a move to value-based care in the United States, which means a fee-for-service model. You come in, you see your provider, and there's a certain rate. That's sort of fading away, and we're moving to value-based care, which means providers are incentivized to have better outcomes for patients. So you'll get a higher reimbursement, in this case, if the government is the payer, if you don't have an infection after your knee surgery and these kind of things. So these traditional systems are sort of breaking down a little bit. The second piece, and probably the bigger phenomenon, and the reason we decided to enter the space was these systems are really good at telling providers what already happened, because that's what you need to do to document in order to get paid, but they're not so good at actually helping providers with diagnosis. They're not so good at actually helping providers care for patients, and that's why we've all experienced this phenomenon, I'm sure you have as well, where you go to see your provider and they spend more time with the system than they do with the patient. So the whole premise of the systems, I think, is fundamentally flawed, and that's why as we look at the new EHR that we announced yesterday, the new AI-powered EHR, it's not just about rewriting the system, but it's about reimagining the actual process of clinical care.
Well, let's talk about that for a second before we get into some of the products. Lots of new and innovative offerings that we've been showcasing here this week. How would you describe the fundamental shift in what we're delivering? Well,
there are several things that I think are paramount. First and foremost, security at the infrastructure level, security at the mid-tier level, security at the application level. That's all baked into what we do. And if you look at the landscape today for applications in the healthcare industry, a lot of them, unfortunately, are highly vulnerable because they're very old. They've been bolted together by several vendors, maybe stitched together by IT staffs and things like this, and they've left, unfortunately, lots of doors open for bad actors. So that's the first thing. The second is rethinking this idea of whether or not these clinical systems need to be just systems of record versus systems of intelligence. So systems of record have benefit in that they collect vast amounts of data. They collect that data, they organize that data, they structure that data. In some cases, they can store binary data or unstructured data, but they've got a lot of it. That data at the point of care is very valuable for a provider. Historically, though, it's been very difficult for any human being to be able to process that much data, even if you think about a single patient. Even if we just limit it to a single patient and say, I'd like to know everything about you from the time that you became my patient until now. And that's over the course of several years. That's even hard to do in the context of a clinical appointment. So being able to harness this data and use the power of large language models, generative AI, and AI in general at the point of care, we think is groundbreaking. And obviously, we've been in the data management business for many years at Oracle. So we're leveraging our strength there to bring all that to clinical care as well.
Yeah, it's going to be a fascinating ride. But let's start with the biggie, the EHR. How is this not just differentiated from competitors' offerings, but something we've never seen before?
Well, I think you're probably best going to see what I just spoke about, the transition of a system of record to a system of intelligence in our new EHR. Our new EHR prompts providers, prompts physicians, nurses, PAs, whatever the user may be, with relevant information about a patient as they're seeing the patient, right? A lot of times, this is done after the fact, or this is called pajama time, where providers go home and they do a lot of research. They use the internet, they use medical literature. They try to bring it all together. That's unfortunately sometimes too late, and you may not see that patient again for 3 days. So how do you get it all to happen instantaneously? And you're going to see that EHR collect data. But the way that it collects data, the way that it still is a system of record, is that it listens to what's happening in the context of a patient encounter. It doesn't require the provider to spend a lot of time at the keyboard. The only time the provider has to spend at the keyboard is to approve what's happened, because the system is listening in the background. Just like a lot of technologies listen in the background today, like your phones and other things, and you can instruct them what to do. It's the same exact paradigm here in clinical care. The other piece is, as the physician is treating the patient, we're going to be harnessing relevant information that may be pertinent to that information and flagging it for the physician at the time of care. So I think you're best going to see this transition from record-based keeping to intelligence systems in the new EHR.
Technology at its best, doing the work for us. To many, implementing EHRs sounds painful. How are we going to help make this easier for customers?
Well, I'll give you a real-world statistic. So our new clinical AI agent, which has now been generally available for a few months, the longest implementation that we've had so far has been 3 weeks for that module.
Oh, wow.
Typical EHR implementations can take 1 to sometimes 3 years.
Oh, wow.
So a particular module has taken 3 weeks. We've already collected, our providers have already collected over 350,000 patient encounters using that new AI system. And the amount of classroom training that is needed, which is not an unusual phenomenon in EHR systems, having classroom training to teach people the system has gone to 0. No training.
Wow.
Use the system, turn it on. It's as easy as downloading an app. I don't think as we make progress on this new AI-based EHR, and as we bring this to market, as we announced next year in its full form, I don't think that traditional implementation of systems will be the long tail anymore. I think what organizations need to think about is the change management. They need to think about clinical care protocols, how do I further automate them, and how do I get my providers excited about embracing AI-based systems. The hard work, the technical work, all happens now behind the curtain, if you will. Right. That happens on the OCI cloud. That happens with the Oracle security team, and that becomes a service that we provide to our customers.
Speaking of the module we rolled out, the clinical AI agent, what's new and how is adoption going?
Yeah, adoption has been very strong. In fact, I spoke with one of our largest customers the other day, and what she told me was, typically when you have a new module, you usually will get, in traditional EHR speak, a handful of providers who will raise their hand to beta test the model. And if you get that, that's great. If you get 5 or 6 people to volunteer to test something brand new, that's great. We have over 60 people in line to test the system already. So the uptake has been certainly, and the team that's been with Cerner for a very long time tells us that there's no other piece of technology in the history of Cerner that's been adopted as quickly and as successfully as the clinical AI agent. And it's only been a few months, right? Oh, wow. So it's just mind-blowingly different than the way it used to be. What's more important, I think, is what the providers are saying about it. I mean, and some of these things are emotional. Providers are people too. I mean, doctors are human beings too. They have their own healthcare needs, and they're burned out, they're stressed out, they're going home, and they're spending tremendous amounts of time doing just really routine documentation because it's a statutory requirement. They have to do it. And what they're telling us, Fritz, is, I left the office at 5 o'clock. I had no pajama time. I was able to go to my child's soccer game tonight for the first time in many, many weeks. I went to lunch today for the first time in months, in years. And when you hear that directly from the providers, there's nothing more humbling and nothing more gratifying than hear that. We are at an absolute inflection point. Healthcare is the perfect industry for applied AI. We wouldn't be at this point, though, if we hadn't spent years at Oracle investing in OCI, years at Oracle investing in the autonomous database, years at Oracle investing in military-grade cybersecurity. Bringing that all together is what's powering the clinical AI agent.
Let's talk about the patient side for a second, too. What's changing with we have a patient portal, and so we're trying to do some of the same remove some of the friction for the patient too, it sounds like.
Yeah, patients today have a very high degree of frustration dealing with portals on EHR in general. So these are the things that you use to make your appointments, refill your medications, look at your latest lab results and things like that. That also is undergoing a renaissance of AI-powered and Redwood UI-powered interfaces. So we launched our new patient portal as well. Again, the idea is zero training, highly intuitive, very easy to use. I mean, I don't think a patient has ever had to be trained on how to go order something on Amazon.com today, right? That's the same philosophy that we have for patient portals. But if you look at the patient portals that are in place today across the universe, this is not specific to just Cerner. This is across the universe. They're clunky, they're old, they're difficult. They're not very intuitive, and what happens is that burden gets shifted to the providers. So the providers have lots of people in call centers who are dealing with making appointments, refilling medications.
Sure.
Now, this should all be a service that the technology provides to the patients. The other piece that I think is highly important for the patient portal, and we spoke about this quite a bit here at the conference, and we'll continue to speak about it, is that in our view, patients own their healthcare record. It should be incredibly easy for you to take your healthcare record if you decide to switch providers, or if you're traveling, you're out of state, and you want that provider to know something about you. All of that should be available in your patient portal, and that's exactly what we're delivering.
Yeah, like my financial portfolios on my phone, everything should be, the same experience as other industries.
There's not much. If you think about every, retail, hospitality, restaurants, banking, there isn't much that you can't do very easily and very intuitively online using cloud-based technology today. Why does it have to be different in healthcare?
Yeah.
The answer is it doesn't. The reason is technology vendors have not done a great job at serving the healthcare industry until now.
I want to touch on one last thing. Part of what has been talked about here is the convergence of clinical care and clinical research, an area that Oracle is playing in both arenas and ostensibly bringing together. Why is that so critical?
Yeah, so today, clinical trials, clinical research, we'll specifically talk about clinical trials, is sort of disconnected from the rest of healthcare. And here's the ironic piece of it. If you're a patient enrolling in a clinical trial, all of your information needs to be put into an EHR anyway, and that's true whether you're receiving a placebo or whether you're receiving the real thing, so to speak. So what happens today is there's a tremendous duplication of data. Clinical trials happen in a silo. Somebody then, it's called swivel chairing, often retypes that information into the EHR. Anytime somebody's retyping something, redoing something, it's prone to error. It's prone to issues, prone to error.
I've heard this before.
So yeah, so there's no reason that clinical trial systems need to be separate.
Yep.
So we're merging together our clinical trials management systems right into the EHR, so that if a patient is enrolled in a clinical trial, we'll flag that, we'll know that, we'll be able to extract that data separately for regulatory submission, but there's no reason to have two completely different systems. The second piece that's very important for clinical trials and clinical research is that you look at the stats today, they're pretty sobering. Only 3% of patients that are eligible for a trial actually participate in a clinical trial today. And that's why it takes a very long time to have a successful trial. It's very expensive to bring drugs to market, and the process is very lengthy. In fact, it hasn't gotten any better in decades. The process has gotten more expensive, less efficient, not the other way around. If we had more people and we were able to source more ideal patients, meaning you are an ideal candidate for this trial, I think we'd be in a much better position. That data exists in the electronic health record. We can help providers and we can help pharma work together to source ideal patients. It's called electronic patient recruitment. I think we can really bend that cost curve. We can really bend that time curve, and more importantly, create better outcomes for patients. We did this during COVID. We did this with the United States government during COVID. We stood up an electronic pre-screener for the then called Operation Warp Speed trials, and we pre-screened over 650,000 people electronically in the United States. We filled every single site, 88 sites there were for the trials, every single one of them. And more importantly, every trial has diversity and inclusion goals, because you want to make sure that you're not developing a molecule that turns into a medication which has an accidental adverse event on certain populations. We not only met the goals, which is really a struggle that a lot of trials have, we doubled them in the Operation Warp Speed trials. That was one of the reasons Obviously, pharma did a tremendous amount of work very rapidly, but it's one of the reasons that we had successful COVID vaccines so quickly. It's been done. It's time to connect life sciences and healthcare as if they are one, because they are.
Great. Well, thank you so much, as always, for joining us and walking us through all the new announcements, and look forward to more.
Always a pleasure to be here. Thank you again.
All right. Well, next up, Kendall is with Suhas Uliyar, who's going to do a deeper dive into the EHR. Over to you, Kendall and Suhas.
Thank you, Fritz. That's right. I'm here with Suhas Uliyar, the SVP of Products for Clinical Health and Healthcare AI. How are you, Suhas?
Thank you, Kendall, for having me. I'm doing excellent, a little bit tired, but it's been a busy summit.
I'll say you've had a busy week. We've had a lot of amazing new announcements, one
Indeed.
of those being around the electronic health record.
Right.
So we'll get into the all-new electronic health record. But before we do, let's talk about the current
Right.
EHR landscape. It is technology that people love to hate.
Yep,
Why
yep.
is that?
So let me start with a quote that one of the doctors said in my session. Said the second most productive time they've had is when the EHR is down.
Yeah.
And
Oh, no.
and the first, obviously, being most productive is when they see patients.
Right.
What has happened is that the technology hasn't evolved since the time of its inception. It's still based on old technology, broken technology, and it's very hard to sort of continue to build on a crumbling infrastructure, right? And so that has really sort of caused physicians burnout, because there's nothing that automates things. It's the EHR has become nothing but a system of data record. That's all it is, right?
Mm-hmm.
It's not a system of intelligence, and the engagement patterns are really, really poor, and that's really driving burnout. Now, what's causing this problem to exacerbate is that the amount of time and effort required to update and upgrade is very, very high, right? So even though there is an opportunity to sort of advance the EHR, the propensity to sort of adopt is low, because they're not seeing that massive jump, which we're now seeing with the new EHR.
Okay, yeah, so let's dive into it.
Sure.
What are we doing to change this? Tell us all about the new
So,
EHR.
it's the perfect storm, if I call that, with cloud and AI and security, right? And we are so fortunate at Oracle to have all of that within the Oracle Cloud infrastructure. We're able to take that and really drive that from the inside out, an AI-first technology. So the term AI-first, what we're doing in the EHR, actually, let me take a step back. Today, most of the EHRs, or in fact all of the EHRs, has some investment in AI. But it's really an afterthought or a bolt-on. What we're doing is, the term AI first, what it means to us is that the AI is at the core of the EHR. What that means is that we've infused AI at every part of the workflow, so we can enable the clinicians to focus on their patients rather than get burnt out.
It's built in.
It's totally
built
built in, exactly.
Yeah.
Right. So and it's the perfect time for the large language models or generative AI to come in. So we can do a number of things, again, built core into the EHR itself, such as I can summarize a day for you. I can summarize a quick glance. I'm driving, I want to take a look at, I can just say, hey, read out the summary for Kendall's patient record, right? And it'll tell you that. You want to go a little bit more detail, give the condition summary. It can give you the medication summary. But along with that, we're also integrating this deeply with other parts of our portfolio, like the Health Data Intelligence platform, where we can surface actionable insights at the moment of care where it matters the most. That's the kind of things that, and also it's a double-edged sword in terms of getting a lot of data. Right? Once you have a lot of data, then it's finding the needle in the haystack problem.
Yeah.
If you don't have enough data, you can't treat the patient correctly.
Right.
So we're solving that problem as well. So we're able to get the patient record across different EHRs, across their claims data, across their pharmacy data. So now we have the full data, but now using conversational AI and using large language models, we're able to find that needle in the haystack. So we can say, has she ever complained about numbness or tingling? Right? We can go, and the answer is a yes or no. It's not, here's 15 pages that you have to read.
Right.
So those are the kind of innovations we're bringing to make that user experience a lot more simple, bringing voice into it as well.
Now, why Oracle? Why did we take on this challenge of building a new EHR from the ground up?
Well, that's a question for Larry Ellison. But no.
What did he say? If we can do it, we should do it.
We should do it.
Yeah.
It's actually, it's a very interesting point that Larry made a long time ago. If I were to stop someone in the street and ask them, have you heard of Oracle? Have you heard of AWS? or Amazon? Have you heard of Google? Have you heard of Microsoft? They'll say yes. If you stop and ask anyone, have you heard of Epic? Have you heard of Cerner?
Right.
What do you think the answer is going to be?
No.
No. So you think about healthcare being the largest industry in the world that can literally it's the number one thing in the portfolio of governments and so on and so forth, but there's no large organization or software company that's actually making software better for the. I think that's what it comes down to is we have an opportunity, we have a technology, why not?
Well, and you also kind of hit on it earlier, right? Which is data is such a center point of this,
Absolutely.
and we are
the data company.
Yeah, exactly.
Yeah,
So,
yeah.
Okay, you mentioned AI a bit earlier, so I want to kind of switch gears here a bit. And speaking of AI, another big piece of news was around the Oracle Clinical AI agent,
Yes.
formerly known as the Oracle Clinical Digital Assistant.
Yep.
First, before we dive into some of those new announcements, can you give our audience a brief overview? What is the Oracle Clinical AI agent?
Yeah, so the clinical digital assistant, or the artist formerly known as clinical digital assistant, now
Yeah.
I'm still finding it difficult to mention Oracle clinical AI agent. So we address the number one issue that clinicians have with burnout, which is documentation. So documentation, and the burnouts not only is evident during the day, their working day, but when they go home. It's called pajama time.
Right.
When they go home, because they're seeing about roughly 20 to 30 patients. In fact, one of our providers sees 45 patients a day, right? And they're flitting from one room to the other. They're remembering things, or they're writing down a piece of paper. They go home, and they spend 2 hours doing documentation that night. And
Only to get up the next day and do it all over again.
All over again. And not only that, but now they now have to prepare for the next day. So it's literally about 4 to 5 hours, right? And so what the clinical AI agent does, other than also help them from understanding the patient and doing the chart discovery and so forth, is to auto document that. So it's participating in the physician-patient conversation, and is automatically transcribing those conversations like you and I are having,
right,
and then converts them into notes. That's a specific structure for these notes, and the physician just looks at it, drafts it, and signs it.
Yeah.
It's really humbling. I'm not a doctor, but it's so humbling when you get unsolicited emails from physicians saying, "This is the first time in the week I've had lunch every day during the week."
Wow.
We have family, and we have couples who are doctors that say, "We are now able to go to our kids' game. We're able to have dinner as a family."
Yeah.
It is so touching to get those kind of responses. So it's amazing.
I mean, we are hearing feedback like life, physicians saying this is life and game changing.
Indeed.
That's huge. What are some of the new capabilities that we announced for the Oracle Clinical AI agent here at Oracle Health Summit this week?
Yeah, so we are expanding its use case across multiple specialties. So when we started, we focused on primary care. Now we have, I think, 20 odd plus specialties that we're going to support. We're supporting multilingual, so we have patients, and there's a melting point here, and we have patients that come in with Spanish or French, and we're able to have that conversation in that language, but translated automatically in real time. We're also enhancing the way we added as part of the workflow itself. So the way we are able to adapt to the physician's workflow based on how they want to see the notes structured. And there are other areas we're adding. So for example, being able to automate actions. So as you have the conversation, typically in an encounter, is what I call it, the physician says, "Okay, I would like you to do a follow-up," or "I want you to go get a lab done," or "Here's a medication order." Just able to take that and automatically generate those actions for them as well.
Nice.
So yeah, so those are some of the advancements we're doing in this.
That's, again, just incredible innovations. And speaking of, to wrap up here, what do you want the the health community in general to know about the new innovations that we are making here at Oracle Health, and how that's really transforming patient care? Anything else you'd add?
Yeah, I would say that, look, our goal is to ensure that we have better outcomes for our patients.
Yeah.
And make stronger providers.
Yeah.
Because we do want to make sure that the providers also get what they deserve from a financial perspective. And so I would say that, we are at the perfect point where we can really enable with innovation to really make EHR a reality for them. I mean, in essence, we want the EHR to become a member of the care team rather than just another tool that they hate.
Yeah, right. I think What did Seema say in her keynote? It was something like, you want the EHR is going to be the best new resident.
New resident, exactly. Yeah. So last year we said it was going to be a scribe. This year it's a resident for you.
There we go. Well, Suhas, this was great. Thank you so much for joining us on Oracle TV.
Thank you, Kendall, for having me.
All right, now I'm going to pass it over to Shauna, who is talking about an exciting new partnership right here in Nashville. Over to you, Shauna.
Thanks, Kendall. I'm here with Dr. Dexter Samuels, who is the SVP of Student Affairs and the Executive Director for the Center of Health Policy at Meharry Medical College. That is a title.
It's a long title.
Thank you so much for being here. I'm thrilled to be sitting down with you and talking to you for just a short time.
Yes, my pleasure.
Well, you know what? Let's dive right in. Will you tell me just a little bit about Meharry and the culture, the mission? Share some with us.
Meharry is really just a fabulous place to work. It was started in 1876. We focus on the underserved, and one of the fascinating things about Meharry is really our history. 40% of our medical school graduates are primary care doctors. When you look at our medical school and dental school graduates, 80% of them work in underserved rural and urban communities. And really a fascinating thing really about our dental schools. There's 5,000 black practicing dentists in the U.S. 30% of them were trained at Meharry.
Oh, wow. That's a stat I didn't know. And, thank you so much for bringing up, the focus on the underserved. That's pretty incredible. And, I want to dive in a bit more on that. And I think this leads into it, some of the challenges that we see in healthcare. How are you uniquely positioned to address some of those?
So when you talk about healthcare, particularly in the U.S., you really got to talk about the cost of healthcare.
Yeah.
We spend over $4.8 trillion in healthcare spending in the U.S., and we're just not efficient. Dr. Tom Leviest, who sits on our National Advisory Board for the Center for Health Policy, did a study recently. And when you look at health disparities, it impacts our healthcare system to the tune of $450 billion.
That's just impossible. that is, the cost is a major barrier. And, I play a role as Executive Director of Oracle Health Foundation to remove barriers, financial barriers for kids who need it. So thank you for bringing that up as a challenge that you all are addressing, because that's a major factor in how we're going to treat healthcare in the future. So thank you. So how would you explain the partnership between Meharry and Oracle?
One, I really want to thank Dr. Feinberg. He's been really wonderful to work with, and the Fin team also has been wonderful to work with. This is really a seminal moment, and when you talk about partnership. When you look at the partnership between Oracle and Meharry, it's really going to revolutionize then healthcare, really for our world. We're going to establish an ACO at Meharry, also going to be a wellness center on the new campus in the East Bank. And then also there's going to be an innovation center where we're going to train physicians, we're going to train students and the community.
That's amazing. This is exciting. And I feel, we are not the only people excited about this. This is just an incredible announcement to think about this. So how together are we going to continue to tackle health disparities, not just in this community, but everywhere?
So when you look at health disparities overall, and you look at the inefficiency of our healthcare system, you really could talk about really globally what's going on.
Yes.
And the Common Health Fund did a study recently, and there are 10 then industrialized countries that they analyzed. The U.S. was in the bottom. They were number 10 in terms of health outcomes. They were number 10 in terms of access.
Wow.
They were second to last in terms of administrative efficiency, and they were second to last then in terms of equity. And so we really got to make a difference.
Absolutely. And I think we're going to do it. So, why do you think Oracle was the right partner in this?
So, Oracle is coming to Nashville,
Yes.
and Meharry is Nashville. And so we're a welcoming community. And we've been doing this for 148 years at Meharry, and it's going to be just a great partnership with all that Oracle is doing and will continue to do. And so it's really going to be a fabulous partnership and affiliation.
That's incredible. 148 years. What an incredible history. And then to think what we're doing now and where we could go together in the future. And when you look forward, down the street and around the corner, where do you see that future?
We're going to eliminate health disparities. There's going to be health equity in our system. That's what we have to do. That's what our God is calling. And I know we're going to get it done.
That's incredible. Thank you so much. I want to be here for that journey, and I'm
Yes.
going to be, because this is absolutely exciting. So tell me a little bit about your experience here. What do you think about the Oracle Health Summit? Are you glad it's here? I mean, why is this so important to bring some of the healthcare professionals together?
Nashville is the healthcare capital of the world. When you look at purchasing power all across the world, Nashville is number one. So of course you got to come to Nashville.
I love that answer, and I think that it's like you can tell there's a buzz and a vibe here between everyone talking about the future of what healthcare is going to look like.
Yes.
It's, empowered by Oracle Health, the new EHR that's coming out, AI and healthcare and so much more, and then announcements like this. This is incredible, and so I'm excited to see where this goes and where our future goes. And like you, I am hopeful, and I'm actually going to use a term that was used several times on stage, optimistic, that we are going to tackle health disparities.
Yes.
So anything else you want to leave us with before we go?
Just want to leave you with just a short story. There was a woman by the name of June. She had 9 miscarriages. She didn't have access to good health care and quality health care. They didn't have the technology. But she prayed, and her husband prayed, that they just wanted this one child. And on December 21st, Adrian Dexter Samuels was born. That was my mom. And so this is really a calling for me. It's a calling for Meharry. And again, we're truly going to make a difference.
Oh my gosh. You are truly special. Your leadership is special. And thank you so much for sharing that story. Healthcare is absolutely something that is personal to all of us.
Yes.
Thank you,
Thank you.
Dr. Samuels.
And now I'm here with Kristen Miles, Oracle's Head of Healthcare Product Strategy. Hi, Kristen. Thanks so much for being here. How are you?
I'm great. How are you?
I'm doing well, thank you. I want to start kind of high level here. You've had a lot going on, certainly. But before we dive into all of the excitement and all of the announcements that Oracle Health has recently announced, can we start with what are some of the biggest challenges HR leaders are facing in the healthcare industry right now?
Yeah, I think from an HR perspective, I think one of the major issues is that we are anticipating a 2 million employee shortage in our clinical teams over the next few years. In addition to that, it's just simply attracting and retaining that top talent because they're constantly working at a deficit.
So how do healthcare organizations keep up with that?
So a couple of ways. So one of them is once you have an employee in the door, making sure that they feel valued and honored. We do that using Oracle products in a couple of different ways. Upskilling in your current role. So if you're a new to practice nurse and you want to continue working in the field, we give you opportunities to move to that next level by suggesting trainings and allowing you to understand what skills you should invest in. And in addition, when you do have a need, we just recently announced the Oracle Talent Marketplace, which is such an exciting thing. Historically, our providers have had to have manual relationships with third-party staffing agencies, and this allows you to literally enter a rec one time and send it out to multiple staffing agencies. We have a partnership with Medley, but in addition to that, you can use the staffing agencies that you've historically done business with.
So this is helping healthcare organizations find talent faster.
Exactly, filling those hard to fill roles faster so that you're not impacting patient care.
And then when it comes, like you said, one of the other big challenges is retaining talent. What are some of the new capabilities that Oracle Fusion Cloud HCM is helping healthcare organizations overcome in that realm?
Yeah, so consider, like, as you value and honor your staff, allowing for flexibility in your schedule. So allowing for our staffing and scheduling workforce management solution, it allows you as a nurse or as any employee to be able to select the shifts you want versus the shifts you are assigned. So it's a wonderful way to empower your employees, which helps them feel valued.
Any other capabilities you want to speak to that is really helping, in all of this?
Well, we've injected AI across the board, right? So even things like, as I need to, at Oracle, right, it's our time to sign up for our annual benefits.
Right.
You can now use AI to be able to do that, where it'll look at your policies and procedures and suggest the right policy, the right healthcare insurance for you, which is incredible. In addition to that, it also performance reviews, they can be so hard. It'll allow you to take input from year round and synthesize that information together and generate your performance review, and I as a manager just have to review it.
Yeah, well, I know how that goes, and that makes it a lot easier for sure.
Certainly does.
So what I'm hearing is the challenges that healthcare organizations are facing, and what we're doing with Fusion Cloud HCM is we're taking actually lessons learned from all industries.
Correct.
They're very similar challenges.
That's right.
So my question for you then is, how do we get to a future of healthcare where we don't ever run into this challenge of, a shortage of talent again? Like, how do we mitigate this for the future?
Yeah, I think it's a combination. I think analytics is going to play a huge piece of this, right? Understanding the needs, understanding the skills, and understanding that not just on the operational side, but also in your clinical side. So understanding, maybe I have a new procedure that we're starting to do. What skills does that require, and do I have a deficit? So as you begin to plan, I'm going to start doing heart surgery. I never did it before, right? These are the skills I'm going to need, so you can start to plan that into your business plan.
Got it. So kind of, again, we've been hearing a lot about this future planning, using data to really kind of grasp what will be needed and what you need as a physician or an employee in a healthcare organization to be the best at your role.
Right.
Switching gears here.
Yeah.
Another big challenge that healthcare leaders are facing right now is inventory, especially with the ongoing volatility of supply chain.
Yep.
Before we dive into how Oracle is kind of helping us in overcoming this, what challenges does this present healthcare organizations, and ultimately what impact does that have on the end patient and provider, physician?
Absolutely. So when you have a disruption in the supply chain, potentially you can cancel procedures, which impacts. I can remember being a patient and having my surgery canceled as I was driving to the hospital.
Jeez.
Nothing is more disappointing than that, right?
After you've mentally, emotionally prepared.
Taken off of work,
exactly.
gotten childcare, all of those things. And it can cost the organization thousands of dollars. I think it's over $4,000 per procedure for each one you have to cancel. So that becomes a huge pain point and bottleneck. So one of the things that, in addition to that, not knowing which products you're going to be using, right? So disruptions are a problem, not understanding how quickly you're moving through some of these. And the uniqueness of healthcare is you don't know what the diagnosis and needs are of the patient that's about to walk through your door. So you've got to be able to take some really educated guesses.
So what is Oracle doing to help? What new capabilities are we bringing forward to really optimize inventory?
We have recently made several announcements. So one around the inventory shortage workbench, which really allows you to have a holistic view across all of your inventories to the supplies that are inside your four walls, and understanding and predicting when you might be stocking out, so that you can take action right from there. In addition to that, we have the ability to now use RFID hardware with our partnerships with Avery Dennison, Terso, and Zebra, so that as a clinician, I go into a stock room, I take the last of something, I simply put that bin up on a top shelf, and it will generate a requisition, so that I'm not stocking out, which can really impact patient care. Similarly, we have the ability to get in like-type products with our partnership with Symmetric Health Solutions. It is the foundation. Data is the key, and clean data is required to be able to connect all of these systems together. And so they have the ability, with this preferred partnership with Symmetric, to make sure all of the data is cleansed and enriched.
Well, I want to call out Mike Sicilia had Sally Deitch on stage from Ascension. And she talked about the fact that, using Fusion apps as well as, running the Oracle Health EHR, all of that combined together really helped solve the, quote, whole problem in healthcare. What is the power of everything being in one system, like we're talking about with Fusion apps, OCI, the new EHR, and so forth?
It ultimately, that interconnectedness allows for similar data, right? A standardization of data to flow. It allows you visibility across your entire enterprise. So whether it's being able to document supplies in a procedure and then be able to then charge for that, and then get paid for that, it allows for everyone to be speaking the same language. It also allows you to say, I've used these products, I now need to go replace them. So it truly allows for your resources to take less manual steps, having to kind of swivel chair, if you will, and really allows the system to do the work for you so they can be focused on value add.
love that. Well, speaking of, first of all, Kristen, thank you so much for being here with
Thanks
us
for
today.
having me.
And speaking of Sally, Shauna is actually with Sally Deitch right now to talk about a real life use case of fusion applications in this kind of all-in-one system like we just talked about. So over to you, Shauna.
Thanks, Kendall. I'm here with Sally Deitch, who is the EVP of Nursing and Operations Infrastructure for Ascension. Sally, thank you so much for spending time with us today.
Thank you. Thank you for having me. What an incredible conference. Oh my gosh.
Absolutely. And we're going to get to that in a second because this is an incredible opportunity to bring people together and talk about the future of healthcare. But I want to talk about you, your leadership in Ascension. So can we jump right in? Just give me a brief description of Ascension and the mission.
Sure. Ascension is one of the nation's largest Catholic nonprofit systems. We operate right now about 138 hospitals across the United States, 18 states. But while I say it's all the hospitals, really when I think of the footprint and the ministries that exist throughout the country, it goes far beyond the walls of facilities into the communities, community health centers. So our mission is to absolutely care for the poor and vulnerable within our communities. It is a mission-guided organization, and to give you an idea of how large the organization is, we employ about 138,000 people.
Wow.
40,000 affiliated providers with the organization, and then about every 1 in 50 babies born in the United States is born in an Ascension hospital.
Oh my gosh, that's a stat I didn't know. That's pretty incredible. So, when you think about your mission and how big that is, how many people you're caring for, how many people are employed, what are some of the barriers and challenges that prevent you from realizing this mission?
If I think about just from a technology standpoint, think of the years and years of these ministries coming together. And for us, our history is so rich and deep. But, our founders and foundresses, the Daughters of Charity, the Sisters of the Sorrowful Mother, the Sisters of St. Joseph, and the Alexian Brothers, it was all of these different ministries within the church. Well, everybody did it different and did it their way. So trying to get to one standardized way of how we do things is always a challenge with that many people.
Absolutely. And, when you think about those challenges again, how has the partnership with Oracle helped to overcome those challenges?
Yeah. Oracle has been foundational within our organization. And when I think of, just from an EHR standpoint and where our electronic medical record kind of comes from, the majority of our hospitals run Oracle or run Cerner, the old Cerner. But when we think of then kind of the back office function, we're in the process of going through a full ERP transformation that is Oracle. So this is really us looking at how do we combine the two and do something that is groundbreaking.
Absolutely. So when you talk about that transformation, what are the products that you're running?
Oh my gosh. Well, if y'all created it, we're running it. So we have Millennium, we have Sorion. I could list them all. There's probably a list of at least 15 different products that we're running. So we run the full gambit from when they were created to the latest implementation.
That's amazing, and thank you. Thank you for being our partners. And I can only imagine, these products are set to help you overcome these challenges you talked about.
Yes.
Which, so let's get a little bit beyond the challenges now. And what else can they do, though, besides that? What other accomplishments are there? What's on the horizon?
Yeah, and I think, part of that, and when you look for us, it's more about how do you rationalize what you have and update to the next version. So when I look at kind of our tech stack and what we're running, it's like, okay, but how do we bring these ones up to the next level? Or how do we put in place to where we're rationalizing so many different applications or so many different systems to say, let's standardize and really rationalize our systems. That's the opportunity.
Absolutely. The opportunity of running a full suite of Oracle products, which is pretty incredible. So how does that ultimately impact the business, the providers, the patients?
Yeah. So let's go, it's almost like you want to go backwards and say, well, it's one thing of how do I impact, say, the provider. you can take it end to end and say this is how it impacts them. So for example, if I look at the ERP transformation and the focus on talent being our employees or physicians, how quickly and easily is it for us to onboard somebody, provision somebody within the system, train them in the system? Are we making things intuitive, or are we creating more barriers
Absolutely.
that then we have to go through and fix?
Right. You know, we don't want to do that. We want this to become smarter, more intelligent. We need it to become more intelligent to connect that care.
Absolutely.
And this goes beyond the business. It goes beyond the providers. And let's talk about those patients, because it's not about just the patients that come into the hospitals. It goes past that.
Yes. And so this is a key. What Oracle Health has done in creating kind of an open ecosystem, right?
Yeah.
It allows you to attach to that in any way, shape, or form. What it's allowed us to do is really allow us to expand Ascension 1, which is our portal, is a way for patients to connect with us. And so not just their information and how we look at what does the patient need, but what do we need to get beyond the walls of the hospital? How do you start leveraging really the information that is already available that says, I know so many patients come from this zip code. What do the social determinants of health look like in that zip code? How do we start making an impact on things that are either detracting from health or adding, or that are additive to health behaviors that we can actually go and impact in that community?
Absolutely. Being able to treat the whole patient where they're coming from, not just when they're in the hospital. This is amazing. I think I could sit and talk to you about this for forever. I wish we had more time. But I have to ask you, you mentioned this being a great conference. Why is this conference important to bring together everyone and talk about the future of healthcare?
Yes. The commitment that Oracle has made to not just saying we're going to do different products and different suites, but being able to say, how do you look at this end to end and use the experiences that Oracle has in so many different industries and businesses to say, we can leverage this in healthcare. And we should have done it years ago, but I'm watching this just move at lightning pace, which, in technology can either go really fast or really slow.
Absolutely. Well, I love the vibe here. There's an energy in the room. We are excited. People are excited for this future, Sally. I'm a fan, not just of your visionary leadership, but you as a wife, as a mom, as a woman. Thank you so much for spending time with me. And I hear that Fritz has a special guest, so I'm going to turn it over to you, Fritz.
Thanks, Shauna. I am here with Sir John Bell. He is the president of the Ellison Institute at Oxford. I joked earlier that was my alma mater. It is not. It is not. I was just joking. Thanks for joining us.
No, nice to be here. Thanks for having me.
Well, it's a great honor to have you here. And can you tell the audience first a little bit about yourself and your history?
Yeah, so you can tell from the accent I'm not British.
You still have the title, though.
No, I got the title. So I'm Canadian, and I first went to Oxford in 1975 as a Rhodes Scholar and trained in medicine in Oxford. Then did postgraduate training in London and then went to Stanford. Spent most of the 1980s in Stanford. Came back to Oxford in 1988 and then have been there ever since. And during that time, I've had a number of leadership positions that's allowed me to build out the medical school in a pretty significant way. But in addition to that, I've had quite an involvement in life sciences, biotech, pharma, and also advising government on how best to run a healthcare system. So that's basically the history.
In a nutshell, that's there's a lot of important things you're leaving out, but that's a good thumbnail. Well, let's talk a little bit about some of the work, especially at Oxford and with Oracle. And your work with Oracle really kind of took off during COVID-19 with kind of a shared vision of getting better data to the right people to, whether it's mitigate spread, inform policy. Can you elaborate on the impact of that work?
Yeah, so it became really clear in the UK, as it was here in the US, that we were largely unprepared for a pandemic from a new virus. And the public health system was in free fall. At the beginning of the pandemic, we didn't have any of the necessary testing or PPE. But most importantly, we didn't have any data. And we couldn't really make judgments about who had the disease, how rapidly it was spreading, how infectious it was, how much asymptomatic spread there was, all those things. We didn't have any of that data. So one of the things I was very involved in was setting up some of the data systems in the UK to actually start to track and monitor what was happening. And they ranged all the way from clinical trials. So we had a terrific set of clinical trials linked into the healthcare system that provided information on, well, more than a dozen drugs, which ones worked and which ones didn't work.
Regarding the COVID-19.
Regarding COVID-19, yeah. So these were drugs which were repurposed.
Okay.
They were not brand new drugs, but the recovery trial, for example, recruited about 40,000 people in the first 6 months and gave us answers that the whole world was working for. I also helped set up the big surveillance epidemiological system that told us who had the disease. It was properly organized, so we had coverage across all the socioeconomic groups, the geography of the country, so we knew what was happening where. And that's the kind of data we needed. And then, of course, we also had data on tracking the changes in the pathogen, and Oracle helped us a lot with that. They provided us with a lot of the support for that. They also helped us track some of the clinical trial data. And of course, ultimately, we needed the vaccine data. Who'd had the vaccine, who then got the infection, who was protected, who was infected, who died, who didn't die. And that all requires a really integrated healthcare record system, which of course Oracle is terrifically good at doing. So, no, it was a great era for trying to patch things together and get answers which we didn't otherwise have.
It turns out to have been a good use of a database that had been around for 47 years.
Exactly, exactly. No, so one of the problems with UK data, and I've been on this issue about getting UK health data better used for decades. Turns out the problem is not the data. I was starting to worry the data wasn't actually there. Truth is, the data was all there. It was just access to data was being impeded by a whole set of rules and regulations that meant you couldn't pool the data in the way you needed to. So the government introduced a thing called a COPI notice, which is legislated for to be used in a public health crisis, which basically allows the government to say, okay guys, all the data is accessible to anybody working on this problem. And that transformed everything. And of course, the UK then went on to provide most of the really good data that the Western world used to understand how infectious the pathogen was, who responded to the vaccine, who was protected, how many people were dying. All that stuff came out of that unified data set. So that really important message. It's not just the data, it's the access to the data.
Got it. Yeah. Well, how will this impact things in the future? Not just for, maybe similarly tough problems, but a lot of problems. I mean, the one good thing we had, or bad thing that turned into a good thing, is we had a lot of data because we had a lot of patients.
Yep.
Right? And all at once.
Yeah.
But that's not the case with every outbreak or infectious disease or other problems.
Yeah. So I think the reality is there is a heck of a lot of data, and getting access to it is absolutely pivotal. But one of the things that we tried to, at the end of the pandemic in 2022, we kind of forced a discussion to say, what have we learned from the pandemic that we can use going forward that would help us deal with not just another pandemic, but any other public health crisis that we had. And to be clear, there are lots of public health crises going on. We got chronic disease, we got the obesity crisis, we got addiction. That was a tough road to follow, because there was a tendency to drop back to the old model, and that is nobody can have access to any data. But we've been chipping away on that, and just in the last month or so, Secretary of State for Health has said, no, we're not doing this anymore, guys. We're going to make data much more accessible. And anybody who wants their data to be used, they can have their data used. There's no problem with that. And secondly, the data ownership of everybody's healthcare data will be two different entities. One is the NHS owns all the data, and secondly, the patients own their own individual data. And that has clarified all the difficulties, because up to then, GP practice say, well, we own the data. Hospital says, well, we own the data. That's all gone now.
Oh,
so, I mean, we've made real progress on that.
That's great.
Yeah.
Now, Oracle has laid out its vision for the future of healthcare. You've talked about some of the great progress that has been made, declines in cardiovascular mortality rates, immune therapy for cancers, first drugs now for dementia and obesity, extended life expectancy, things like that. But there are still so many systemic challenges. Which ones are you looking forward to seeing Oracle help tackle the most?
So, first of all, I think the central theme that runs through all these solutions is going to be data. So I think Oracle is going to be involved in a lot of this. The one that gets me, actually there are two that get me really excited, and the Ellison Institute's working on both of them. One is that the pattern of disease has fundamentally changed in my life as a physician. So when I trained as a physician, we all used to run around in hospitals treating acute conditions in young and middle-aged people, heart attacks, infections, this and that. And that was all fine. But a lot of that problem has sort of largely disappeared and has been supplanted by this epidemic of chronic disease. Because of the shifting demography, people living longer, we've now got a lot of people who've got 4 or 5 or 6 different chronic diseases. Diabetes, obesity, heart failure, cardiovascular disease, strokes, dementia. And the only way to solve that problem is to take a prevention-oriented attitude. In other words, get at people before they get their end-stage disease. So we're going to move from an acute care, late-stage sickness system to an early phase intervention that preserves health and allows people to have prolonged healthy life expectancy. That's the game. You can't do that without community-based services that will provide people with the therapies they need, intervening early, health checks, monitoring those big chronic diseases, and flattening the morbidity curve. So that really gets me pretty excited, and Oracle will have a big role to play in that. The other one is that, one of the frustrations after the pandemic is almost all governments promised to set up a pathogen surveillance system so we would know what bugs are out there. And of course they didn't. Guess what? So we've decided that we're going to do that ourselves, and we're very interested in using a point of care bedside genetic diagnostic tool that will allow us to understand which bugs are infecting people, but also what are the patterns of antimicrobial resistance. Are there new pathogens out there? And we're going to try and roll that out on a global basis so that we have a single source of information on new infectious diseases.
And you're doing this is work you're doing at the Ellison?
At the Ellison, and Oracle are providing quite a lot of the cloud support, the databasing, all that stuff. So that will be a new globally reaching tool that we'll all be able to use.
Great. Well, that sounds very exciting. I'm looking forward to seeing how that goes and keep in touch. Thank you so much for joining us here today.
No, my pleasure. It's been a great day.
All right, now I am going to toss it over to Kendall to hear from one of our other customers about how they're leveraging our new patient administration tool, financial management, health data, and much more.
Thank you, Fritz. Well, now I am here with Lynette Clinton. She is the CIO for BayCare Health System. Hi, Lynette. How are you?
Hi, I'm great. Thank you. I'm happy to be here.
We're so happy to have you. I'm going to start a little high level here. Can you first tell our audience a bit about BayCare Health System and your mission?
Sure. BayCare is a large integrated healthcare delivery system in West Central Florida, including the Tampa Bay area of Florida. We have 16 hospitals, extensive outpatient care, and more than 32,000 team members. We are proud to be a not-for-profit health system working and dedicated to improving the health of our community.
So what obstacles or bottlenecks get in the way of that mission of, improving healthcare in the community?
The biggest thing that I can think of is the rising cost of healthcare. That is a bottleneck for every step of the healthcare delivery system. And with our roles within IT, we have a primary place to help with that cost. So we need to partner and look for ways to reduce that cost of rising cost of healthcare.
Well, speaking of partners, tell me about how the partnership between BayCare and Oracle helps mitigate that challenge of cost. And in the keynote, Mike Sicilia talked about how having integrations with a bunch of different systems can often have those kind of hidden costs. How does Oracle help BayCare in this area, especially, like you said, as an IT team?
Yeah, it really, we've made a choice a long time ago about choosing one integrated system for our EHR, and as much as we can surrounding that instead of a best of breed model. So partnering with Oracle and Oracle Health and others like that, it really helps us break down and streamline the care delivery that we have. And that's what we're looking for.
Well, speaking of our partnership, you became a beta validation partner for Oracle Health Patient Accounting and several other products. Can you talk to me about that decision and about what you're doing in these areas?
Right. It's a very calculated choice when we do a beta partnership. Sometimes we do it and sometimes we don't. The reason we did it with Oracle Health Patient Accounting is because we knew we want more customers to use this product. It's beneficial for us. The more customers using the product and being successful at it, the more feature rich it is for all of us.
Right.
So we want to do that. And we're also partnering with we're reviewing a few different vendors on ambient listening right now, including the Oracle Health Clinical Digital Assistant. So we're excited about that as well. We're definitely partnering, giving lots of feedback on that.
Okay, you mentioned the Oracle Health Clinical Digital Assistant, which was recently renamed to the Oracle Health Clinical AI Agent. Tell me a bit about some of the initial success with this project.
Right, happy to. The big thing is every release that's come out has been drastically better. And that's what you want to see. It's new. It's newer than others that have been on the market now for just a little bit longer.
Right.
So every release is so much more improved. Even the September release, last week I heard our physicians talking about how much better it is than the previous one. So we love partnering, giving that feedback, and we're seeing feedback right away. But what most excites us about this product, which I can't remember the name of already, the new name.
Clinical AI Agent.
Okay, that product. It is the way that is the roadmap. We are excited to see how it integrates with the record and how we'll be able to call up the chart and do other review of the chart, place orders, and the nursing workflow. We are thrilled about the nursing workflows.
So you're already seeing some efficiency and success by incorporating this.
I would say we're early.
Okay.
So we have a few physicians right now testing the OCDA, and we are giving feedback to help develop the product for nursing workflows. So they're not piloted yet, but we'll get them as soon as they're ready.
Well, what impact ultimately do you see this having on the physician and the patient? We're always trying to make the patient experience better.
Absolutely.
What do you see this? How do you see this improving that?
Yeah, and it's not just the physician, right? We're looking forward to this for all of our clinicians, those providing care. We want them to go back and spend more time with their patients and frankly their families.
Yeah.
Our physicians spend a lot of time at home or long hours. We want them to be closer to their families and their patients. And we know that happy team members and happy physicians make happy customers and patients. So that's really what we're looking forward to. It all comes down to the patient and spending more time with those patients and for our community.
So we're talking a lot about the future of healthcare here at the Oracle Health Summit in Nashville. How do we get to a future of healthcare that really minimizes these challenges, minimizes the challenges where we're taking, physicians and clinicians away from their families, right? Where there's that burnout, where we're not spending enough time face to face with the patient. How do we get to a future where all of that's minimized and everybody's happy?
Yeah, partnership.
Yeah.
It comes down to partnership and relationships. It's one of the things the reason that we're here, we have an extensive contingent of BayCare executives here at the Oracle Health Summit. We know that a strong partnership here is the solution. We have to figure this out together, and it's going to take all of us to do it.
What a great response. To wrap up here, what is the importance of an event like this for the healthcare industry, and a conference that brings everybody together? What would you say to somebody who maybe is watching right now who's not here, but you think they should be in the future?
A couple things. Relationships. It's about the immersion into this process, and it's about getting your bucket filled. It's reinvigorating, what we know is going on. There's a lot of transition happening between Cerner and Oracle Health, and we're in it for the long haul. We hope to be. We want to be. And we see the light at the end of the tunnel. And this type of event helps us really fill our buckets to say, what, we see this, and we see that on our roadmaps every day. So there's more and more delivery all the time. So these events like this are about relationships and filling it up again.
Well, I appreciate that response so much. Thank you so much for joining us, Lynette.
Yeah, thank you. Appreciate it.
And now to cap off our conversations about the future of healthcare, I am going to hand it over to Fritz to talk about just that and Oracle's role in it. Fritz?
That's right. To finish off our time here at the Oracle Health Summit, I am joined by Dr. David Feinberg, Chairman of Oracle Health. How are you doing today?
Oh, I'm doing amazing today. I mean, we've had a day of announcing this incredible acceleration in our products that I didn't actually believe could ever happen.
Well, here we are. It's being demoed all around us, and very exciting times. Now, you spend a lot of time talking to customers. What are some of the common pain points that you're hearing right now?
I've had the opportunity in this role and at Cerner to go around the world and listen to our customers. And they all start out with, it's different here. And then they tell me their problems. And it's the exact same list. So the list is, nurses, we're having trouble staffing. Our physicians are burnt out. We have trouble with patients getting access. We can't find data that we need. We're trying to grow and don't understand kind of the business imperatives of that. So that's what our customers are talking about, and I can tell you they're talking about that around the world.
Yeah, we've heard a lot of that today. You read a lot about it. It's kind of, some of these challenges have been around for many, many years. But today and this week, Oracle has laid out quite a vision for the future. What are some of the areas that you pull out as most interesting?
I would say there's two. The first, and as a clinician, as a doc, this one really gets me excited, is basically fixing the electronic health record, right? It is this system of record that I don't know any other industry where the end user is actually interacting with the system of record. But that's what we did with these electronic health records, and there's a whole history and a why. What we showed today in our new EHR is a design that allows clinicians to spend more time looking in patients' eyes, to give nurses more time at the bedside, and leave all that other stuff to us. So to me, that's a monumental change. And then as part of Oracle, we're no longer just EHR. We're talking military-grade cloud security, back office, ERP, human capital management, supply chain, life sciences around clinical trials and devices, as well as claims adjudication and payment. An entire platform that makes it not only easier for the doctor treating the patient, but for that whole ecosystem to be able to understand how to do things better for that patient, for patients that maybe haven't come in, for populations of patients, and in many cases, the entire country.
Very exciting.
Oh yeah.
And there's more to come, as I understand. How are health networks looking to technology to solve some of the problems that you talked about?
Well, I would say a couple of things. One, our customers come to us with specific pain points, and we can use technology to solve those. And the list of those could be, we're having trouble with pre-authorization. Even folks not in healthcare have been through that experience.
Sure.
Of, should I get my MRI, or it hasn't been approved by the insurance company, or the new medication? So, and the AI can be really helpful there. I think that people don't actually want their medical records. They want to know their bad cholesterol. They want to know when their gynae appointment is, right? You want information from that data. So we can help solve those problems. I think there's also problems that our health systems don't even know are problems that we can help solve. And that's by connecting. Think about it. I'm a health system and I want to do a mammography campaign because our mammography rates are down. So typically we would just say, oh, let's do that in a few months and send out some emails. Well, now with what we're offering, you could say, hey, Oracle, I want to do a mammography campaign, and you know what kind of staffing you need, what kind of facilities you need, how the campaign would run, what are the finances for it. So I don't even think they know that's a problem yet, and we're really, really leaning in to try to solve that one too.
I would imagine too that, what are the best ways of reaching people and getting the rates up would be another part of that collection of data and understanding it, being more effective with such a campaign.
Yeah, we could fix healthcare if we can engage the unengageable.
Right.
And so when you think about that, how do you get folks to do things? And I really think if we're back here in 4 or 5 years, I think we're going to get to the point where I could write out your electronic health record for the next 10 years. I could say to you, here's what your record looks like. Literally, it is just a large language model. And if you want to be at your kid's graduation, you need to change this behavior because look what's happening to you in 3 years or 4 years. I think we're going to get to that ability to predict people's health futures, and that can be a great way to engage people in positive health change.
Do you think colonoscopy would be in my future?
Absolutely. You look like you're over 50. The key to the colonoscopy, a couple things. And AI can be helpful there. First of all, you want to schedule it for early in the morning. The docs spend more time early in the morning.
Okay, good to know.
But when you do a colonoscopy, they're looking at this polyp and should they do it. We've been able to look at how AI can tell folks in any of the computer vision, retinopathy, skin, mammography, colonoscopy, hey, that looks suspicious, and increase the rates of, or decrease the rates of false positives and false negatives, where you shouldn't have taken a biopsy, you should have. So,
right.
So not only is a colonoscopy in your future, a colonoscopy aided by AI is in your future.
That'll be fun. I'll let you know how that goes.
Exactly.
Speaking of AI, you're painting a positive picture. Are most doing the same, or do people think it's, especially on the provider side, seeing it as a hindrance?
Well, I thought you were going to ask a different question, so I'm going to answer that one.
Okay. Sure.
Okay. My biggest concern on AI is that we train it on data that oftentimes is inherently biased. So if you train the model on bias, well, let's go to mammography. If we train it on women in the United States that has less fibrous tissue in their breast than they do in Japan, and then try to use that model in Japan, it's not going to work well, right? So you can think about that from a gender issue, a race issue, access issue, a socioeconomic status issue. But the data that we're training these models on have the inherent bias of our healthcare systems. Mm-hmm. So how do we then say, when you use this colonoscopy AI, it should come with a nutrition card that says, hey, use it in this situation. It may work in this situation, but be careful in that. I think that's our biggest issue that we need to be really cognizant of with these new models that are coming out. But I forgot your real question. But
that's a better answer to a better question that I'll think of next time. Just to wrap it up, we've been talking a lot about the future of healthcare here, and what should be top of mind for healthcare organizations today as they take steps towards that better future.
So to me, healthcare, if you boil it down, is people caring for people and it's based on trust. If you lose sight of that, this entire business makes no sense. So what's our role in that? As our customers, whether that be a payer, a life sciences, a provider, a government, we need to provide them with the ability for their people to do their thing. And that could be self-care at home, that could be a professional caregiver taking care of you. And the key to that is that the data is secure, right? That's the trust issue. If you lose that, you've lost everything. So not only is it secure, that you get the right data at the right time that allows you, with the person you're caring for, to make a plan going forward. That's our role. It's a big deal, and I think it's foundational, but we shouldn't lose sight of that we're really in a supporting role, because the real role is the nurse practitioner, the nurse, the pharmacist, the doc who's sitting with the patient talking about, hey, what should we do next?
Fabulous. Well, as always, thank you so much for joining us.
My pleasure.
All right, and now we're going to get back to Kendall and Shauna to close us out one last time. Back to you, ladies.
Thank you, Fritz. Yes, sadly, our time has come to an end here with Oracle TV from Oracle Health Summit 2024.
But don't worry, because we have plenty of healthcare coverage to fill your cup. And for starters, you can catch all of the content from Oracle Health Summit on demand for the next 2 weeks. And we've left a link in the description of this live stream for you to register for your Oracle Health Summit digital pass.
That's right. And hey, you can also catch the conversation between Oracle CEO Safra Katz and Oracle EVP and GM of Oracle Health and Life Sciences, Seema Verma, on YouTube. You can hear their conversation about the future of healthcare and life sciences and Oracle's role within that.
That's great. And we've also shared a fireside chat between Larry Ellison, Oracle CTO and chairman of the board, with Sir John Bell, who is the president of the Ellison Institute at Oxford. And that conversation dives into it a bit deeper into the new Oracle Health EHR, AI in healthcare, and so much more.
So much more. And we have provided the links to both of those live streams on demand in the description of this live stream, wherever you are tuning in from. And hey, make sure that you give us a follow, a like, or a subscribe for more content just like this throughout the rest of the year. In fact, Oracle TV is going global with the Oracle Cloud World Tours. So make sure you give us a follow so you don't miss any of the action from all of those cities all over the globe.
And thank you so much for joining us on this journey here at Oracle Health Summit in Nashville. It has been a fun and exciting time, and we appreciate your comments, your shout outs, your participation in this amazing event.
I second all of that. And now, Shauna, I think it's time to bid farewell.
I'm Shauna Adamick.
And I am Kendall Fire.
And that's a wrap from Oracle Health Summit 2024 in Nashville.
Thank you so much for joining us. Bye.
Bye.